It's time for another podcast by George. Straight talk, straight from the Heartland, that'll have you saying, "By George, I think he's got it." Now, here's George.
Hello, hi, how are you? Welcome into another podcast by George. We're turning our attention back to coronavirus, the scourge. I've kind of laid off of this for a week or two because of the election, but there's one thing that has been driven home, particularly here in the Heartland. Coronavirus doesn't wait on anyone. And it is surging here in Iowa. And today we've got back on Podcast by George the doc that's been helping us understand all of this, and it's Dr. Andrew Nish. Dr. Nish, thanks for coming back to the PBG.
Hey, thanks for having me, George. Here we are again.
Yeah, and as projected, as predicted, we kind of knew this was coming. There were steps that we could take to mitigate it. We haven't done as good a job as we should have. I'm sure you'll agree with that. And to start this podcast, I want to put this chart up on the screen here. This was really an eye-opener out of the USA Today. Now, this is specific to Iowa. Look at this graph starting back in March when it was at 0. Look at that line go up. And those are current hospitalizations in the state of Iowa. It is really alarming. So the first question for you, Doc, is, how are we doing?
Not well. We have record numbers of patients hospitalized right now. So back in the late spring, in May, we saw a peak of about 71 people. Our census as of yesterday, I don't know today's, was over 90. So we're seeing an increase in hospitalizations. Downtown at Methodist, we had no available beds yesterday. So this is becoming an acute problem. And you have to remember, hospitalizations lag behind cases by anywhere from 10 days to 2 weeks, and then deaths lag behind that another 2 weeks. So we haven't even, I don't think, seen the peak of this at this point, because our caseload continues to go up, our positivity rate continues to go up. We continue to not have mandates of mask wearing like we should. And this is a critical situation. And I being a healthcare provider, and I just got off the phone with one of my colleagues who's at the Blank Children's Hospital. And I don't think people understand the toll that's taking on workers.
Yes.
Our workers are stressed. Our workers are strapped. And we think that these people can continue to work at this level day after day after day, and the system is going to break down. We're asking an extraordinary amount from our healthcare workers. And when we see day after day more people coming in and more people dying, it takes an emotional toll, it takes a physical toll, and there's only so long people can do it. And so, when you think about going out, when you think about doing something in public, don't just think about yourself. Don't just think about those people you're going to interact with. Think of all the healthcare workers that are working so hard and diligently to take care of these people, and think about wearing a mask to help them out. Yeah. And when I say healthcare workers, it's not just doctors and nurses. It's all of our techs. It's all of our housekeeping people. It's all of our maintenance people. Without all these people, our systems don't function. And if we get to a point where we have more and more people out now because of either having COVID or they're quarantined because they were exposed to COVID. So all of a sudden we have more healthcare workers who can't come to work because of these exposures. And this can become a real domino effect. And, I was talking to one of my colleagues this morning about mental health issues. And, we're going to be working towards what can we do mental health-wise to help our workers out. This is a critical situation, George. And I think I need the average person to understand that protecting themselves, protecting your friends, is also protecting your healthcare workers.
And in regards to those healthcare workers, they're heroes. If you don't think so, you go do it. Honest to God, nobody in this country has to do anything. Those people could just pick up and walk away. They're not. They're staying on the job and they're dealing with this. And it's unbelievable. Iowa has the 4th steepest outbreak curve in the country right now. And Doc, talk to this a little bit. I mean, I don't want to scare people unnecessarily, but when people say, oh yeah, COVID, coronavirus, well, the people, most people won't get it. Most people that do get it will survive it. Some people are going to be mildly ill even. But if you get this really bad, nobody wants to die this way. I see people interviewed that say it's like drowning because it affects their lungs so much. That's the first thing. And the second thing that everybody seems to be overlooking, they say, well, yeah, the hospitals are at capacity. They're out of beds. Well, what happens let's say you've got it. Let's say you're really sick. You go to the hospital, you need a bed. What happens if there's no beds? What's next?
That's a good question. We transfer people to other hospitals with beds, but as more and more hospitals fill up, there may be nowhere to transfer people. I know in other states, they're, opening up field hospitals. They're doubling beds in rooms. So we find ways to keep people in the hospital and keep them cared for. But it can take a lot of creativity. And so whether it's a field hospital with tents outside, whether it's doubling up on beds, the health system we're going to have to be creative, and people are going to have to accept some of the lack of luxury or whatever you might anticipate in a hospital for actual care. So it's unknown to me what's going to happen.
And speaking of unknowns, I wanted to turn our attention also to something that I know you follow very closely, and that's this news about a vaccine. A big news this week, a real blockbuster from Pfizer Corporation about this vaccine that they have. Some people are saying it'll be rolled out to small groups maybe in a month or two. I look at that and this doesn't seem quite right to me, not from what I understand of how the testing takes and how the distribution the time that it will take. And I know Pfizer is excited about this news, but I look at this and I think it sounds a little bit like a marketing thing to me. I don't know if that's maybe being too unfair or critical, but is this real news, or is there a little bit of fake news involved in this?
I don't think I'd classify it as fake news, but I would temper the discussion a little bit with the devil is in the details.
Yeah.
And we've not gotten the details yet. So the population that's been vaccinated or not vaccinated, this has not been peer reviewed. This has not been scrutinized by the scientific panels. I think that the news is exciting in that if they truly have a protection rate of 90%, that is significantly better than we had hoped. But at this point, that's all that is. That's all that is. And yes, Pfizer brings this out. And yes, pharmaceuticals are marketing machines, and that's what they do. So from a scientific standpoint, the 90% is good news, but we have to remember none of this has been reviewed. The data has not been released. The FDA has not seen the data and has not gone through the, EUA process. The independent advisory board who will be reviewing the data hasn't. So we don't have the scientific data yet, and it's preliminary. That's it. So it's good news. 90% seems like extraordinarily good, but we've got to temper that with, number one, what is the data going to show us? And nobody's reviewed it. And number two, in my career of 30 years, you see things come out and the initial data looks really good and promising. And then over time, we come back to reality a little bit. So I think that will be the way with the vaccine. It looks great. 90% looks terrific. Probably over time, that's going to come back a little bit. Maybe it's 70 or 80, which is still incredibly better than 50. So we need to be patient and we need to be thoughtful in our interpretation of what this means. I don't know the timeline. I don't think anybody knows the timeline of when we're going to actually see vaccine in arms. This is a messenger RNA vaccine. This vaccine has to be stored at something like minus 76 degrees Fahrenheit. That means distributing it in incredibly sophisticated freezers and dry ice. So we have this distribution system that we're not used to. So we may have a vaccine that's potentially viable in the next month, but the distribution chain has yet to be secured.
You know, and I had a lot of questions looking at that news that I want to ask you about it. We talked about the different type of vaccines, and this one's one that, like you say, has to be 70 degrees below zero to be transported. It's a two-step vaccine that they've
It's two doses.
Yeah. Um, is that Are the other companies working on parallel tracks with other vaccines that wouldn't be like that? Number one, and then number two, are there vaccines out there right now that we take that have to be frozen and transported like that we may not even be aware of?
No. So number one, there are no vaccines out there that have to be frozen like this. Number two, there are no vaccines out there that are a messenger RNA vaccine. So this is brand new technology that we've never had mass distribution of. The other answer to your question is, so the Moderna vaccine, which is also in trial, that's also a messenger RNA vaccine that will also need to be frozen. It's also a 2-dose vaccine. The J&J vaccine, so the Johnson & Johnson is a vector viral vaccine. That one does not need to be frozen, and that one is a single dose. So we're really waiting on J&J to see what their vaccine is going to do, because it makes the logistics significantly simpler in distributing that vaccine, because it doesn't have to be frozen and it's a single dose vaccine. Now, they started their trial later. They're enrolling 60,000 people right now. Their trial was put on hold briefly. There was a death in that trial, but they realized that death was in the placebo group, I believe, and not in the vaccine group. So we'll all be waiting for the J&J trial, but that's probably going to be early next year, the best I can tell from what I read. So yeah, there's lots of logistics here, and we're dealing with vaccines that have never been distributed in a mass distribution fashion to the public.
Well, envision a vaccine for us a little bit. If it comes out, you're still going to have to quarantine and wear a mask because it's got to roll out. It's got to get out there to people. I mean, it's got to be distributed. Might take months, might take a year, maybe longer than that.
You know, George, we've talked about this before.
Yeah.
You know, we're all excited about a vaccine. Every one of us in the scientific community is excited that we may have a vaccine. But I just want to prepare people again, prepare for the worst, hope for the best.
Yes.
It's all in how you prepare your mind for this. So if you've prepared your mind that, we're going to have a vaccine by spring, now life will go on, I think you're going to be disappointed. If you prepare your mind for, I'm prepared to continue these public health measures with mask wearing for the next year to 18 months, then all you can do is be surprised that it will be before that. So even if we start rolling out the vaccine, let's say in February, and even if let's say it's 90%, you're still going to be having to wear masks for months and months and months, because not everybody's going to get the vaccine. Not everybody's going to respond to the vaccine. And here's the big question. How long does the vaccine protect us for? We don't know the answer to that.
Yeah.
So there are many unanswered questions. And so I want to prepare people's mindset for continuing to practice public health measures of mask wearing, universal mask wearing, universal hand washing, and universal social distancing, and be prepared to do it for another 12 to 18 months.
I promote these podcasts, and the fact that you're coming up again, I got some questions, and one of them from a viewer was, what can they do that's a little bit above and beyond? They're doing everything they can to protect themselves and their families, doing the right things as far as self-quarantining and wearing masks and hand washing and that type of thing. But if you want to help this process along and help others, what would you suggest?
Okay, so I think that's kind of a multifaceted question. Help others. So how can we do it on an individual basis? Pick people you know in your life who are living alone and contact them and make contact with them. I feel so bad for people who have no support system. They're living alone, they can't visit their friends, they don't have any family. So if you want to make a difference in individual lives, find those people who are lonely and who don't have a support system and call them on the phone and just say, hey, I'm thinking about you. What can I do for you?
Yeah.
So that's one level. The next level, and this is maybe what they're alluding to, how do we as individual people affect public policy and affect getting the public to do the right thing? I just signed this morning, the Interfaith Alliance has put out a document, a letter to the governor of Iowa, imploring her to have a statewide mask mandate with no caveats. You go out, you wear a mask. And so you can go on the Interfaith Alliance website and you can sign that petition. I've signed multiple petitions to the governor and nothing seems to make any difference, but it's worth a shot. The other thing you can do is make sure you're caring for yourself. Make sure that everybody in your contact sphere, Facebook friends, Instagram friends, family, neighbors, make sure that the message is do these things. Wear that mask. Anytime you go out in public, you got to have a mask on. It's just like, I don't go out in public without pants on. It's the same thing. I do not go out in public without a mask. Now, do I wear a mask when I'm riding my bike? No. Do I wear a mask when I'm walking in the park? No. Do I wear a mask when I know I'm going to be around people? Absolutely. So just think of it as, would you go out in public without pants? And the answer is no. And the same thing should hold true for a mask.
People wonder with the podcast I'm wearing pants, folks. They're on, so.
Way to go, George.
We're out of time, Doc. That's what I love about Dr. Nish on the podcast. I mean, we're getting sound medical advice, but we're getting good common sense advice too. Wear your pants, wear your mask, folks. Doc, I'm going to give you a last word here as we wrap up.
My last word hasn't changed in months. My last word is protect yourself, protect all of those around you by wearing a mask, and protect your mind. Protect your mind. Don't let your mind run rampant with all the news that's out there. As we talked earlier, to me, we've had a dramatic shift in our national leadership, and no longer do we have to listen to the nonsensical spew out of Washington every day. I believe we now have a national leader who is thoughtful and will do what the science is telling us to do. And to me, that's an enormous relief that, on Saturday when they announced that Joe Biden was, a president-elect, I really became very emotional about it. And I kind of am now.
Yeah.
Just because the national discourse has been so toxic the last 4 years. And we just have to get to a place of love and compassion and get rid of this anger and hatred and really follow what the scientists are telling us and not what people's minds are telling us. And so I think this is a great opportunity to really sit back and look at what our national leadership will be and really be hopeful that they will send this message of reconciliation and compassion to everyone.
Yeah, that's well said, Doc. And honestly, I appreciate you coming on the podcast, helping us walk through this calamity that's spreading across the heartland here. Winter's about upon us. I mean, the days are going to get shorter. They're going to get darker. This is probably not going to get better anytime soon, but there is light at the end of the tunnel. Springtime will be around the corner. A vaccine is in the works, and with good social distancing, mask wearing, and all of those things that we need to do, we can help ourselves and help our fellow man, and I guess I should say fellow woman also. Doc, thanks for coming on Podcast by George.
You're welcome. Thank you for having me.
And folks, if you enjoy Podcast by George, if you like hearing Dr. Nish and our other interviewees that appear on the show, please like us on Facebook. That's probably our biggest platform, but also you can watch us on YouTube and subscribe there, ring the notification bell. We have a lot of listeners of the audio-only versions of the podcast. I think people listen to it in their cars and on their iPhones. And, of course, you can subscribe on iTunes. But that's going to wrap up this particular episode. That's going to do it for now. That's all there is, and there ain't no more. That's another podcast by George.